Hi. In the interest of time, I'm just going to jump right in. I just need to figure out the clicker. Got it. No disclosures. So I have been speaking on this topic or similar to it for almost a decade, and I wanted to share right off the bat. I make it a point to have a Google Drive that I have uploaded everything I've ever made for the Ehlers-Danlos Society, freely downloadable, encouraged to share. You can use the tiny URL that is there, or snap a picture of this. Anything that I've ever said, anything, given the fact that we only have 20 minutes to speak, there's a lot of topics that I have expanded on that I will only touch upon in this lecture, so I encourage you to look when you can. So, how many of you, when you were diagnosed, asked your doctor if it matters what you eat? Show of hands. How many of you were told that it matters? Not very many. So the point I want to make right off the bat is that before we even talk about diet, nutrition, supplementation in people with Ehlers-Danlos syndrome, it's important to realize that problems with nutrition affect connective tissue health for all humans. Connective tissue is in every square millimeter of the body, essentially. It's necessary to have healthy growth of all these different things: bones, joints, cartilage, muscles, tendons, ligaments, fascia, skin, everything. Blood, including mast cells, organs, even the process of pregnancy depends upon the connective tissue having healthy nutrition. Healing from injuries, illnesses, maintenance, healthy aging. With the passage of time, we have to maintain the connective tissue that we have built and healed. This is a very busy slide intended for you guys to look at later, just to stress, when we think of connective tissue, or especially when we're thinking of Ehlers-Danlos syndrome, the tendency is always to frame it as it's a bone or a joint laxity or maybe some skin findings for the average physician that hasn't really learned that much about Ehlers-Danlos syndrome. But we, as people with Ehlers-Danlos syndrome, need to understand connective tissue, given that this is a connective tissue difference or a connective tissue problem, is not just in those tissues. And these two slides give some summaries about where you can find them and the differences in those tissues in those places. So what happens to connective tissue without healthy nutrition? Well, you clearly have problems in those things that connective tissue needs to be healthy for. You have problems with healthy development and growth. So, you know, our young zebras who felt fine until they hit a growth spurt, etc., that can be a particular problem area. Healing after injuries, illnesses, recoveries from surgery. Some of my patients that I see say, I was fine until I had my pregnancy. And then aging, just the changes that happen over time. I like to say those of us with EDS are a little bit gravity intolerant, and aging is just gravity over time. So just a couple of examples just to underscore. Again, not even talking about persons with Ehlers-Danlos yet, just talking about humans and how nutrition is very important for connective tissue in general. So some examples of nutrient deficiencies: vitamin D and vitamin C. Vitamin D causes rickets in the very young. That's when the vitamin D deficiency affects the growing skeleton, whereas some of the vitamin D disorders can affect bone density, bone mineralization, bone mass, and then vitamin C cross-links collagen. So when we talk about scurvy, that is a connective tissue disorder. So little kids with rickets and some skeletons demonstrating the advancement in age with osteoporosis or some of the bone mineralization disorders. And then scurvy symptoms, which you guys probably can't see, but it includes bleeding of the skin and mucous membranes, gingivitis, loose teeth, rough, dry skin, joint and body aches, fatigue, depression, increased susceptibility to an infection, and muscle weakness. Sounds an awful lot like what we see in many of our symptoms. So I would challenge the audience. You can take a look back if you want to look back at one of my prior talks. I spoke in Nashville regarding nutrition, and one of the topics I covered was, why is it that doctors don't seem to help us and tell us much about nutrition when we're trying to navigate Ehlers-Danlos syndrome? Doctors are not given a lot of education in nutrition, maybe 20 to 25 hours in the entirety of their studies, unless they choose to pursue it as a special area of interest. So I would say to those of us with EDS, it's our challenge to learn about nutrition, because if we don't, I don't really expect that most of our doctors are going to do it for us. So goals for learning about nutrition include learning what makes a diet healthy for humans in general, even before you get to thinking of a diet in EDS. And the more you understand about nutrition, it's you taking control of your own health and being able to work with your clinicians and better understand and advocate for yourself. Realize that nutrition's ultimate goal is to get your cells the structural materials they need and provide them with fuel to operate. And nutrition isn't just a matter of the food on your plate. It involves what you do take in, whether it be foods or supplements and drinks. It also includes the act of digesting your food, which depends on the things that Dr. Pace was just talking about in a healthy alimentary tract. Digestion is where you break down food into much smaller mechanical particles, and there can be mechanical digestion and then chemical digestion until you can absorb those nutrients, and then your body can do with them what it needs. And then there's some additional topics to learn about. Does food preparation affect the nutritional content? We hear fad diets like you have to eat everything raw, you have to eat everything steamed. There's topics like, should we go GMO versus non-GMO, organic versus non-organic, and then, we should be thinking of ethically sourced foods in general. So to learn, use the tools you have. You can Google, you can use apps. If you don't like reading, you can look for visual aids to help you understand nutrition and the things involved in having a healthy diet. This is a good diagram for starters. It's showing you that in spinach, for example, it gives you a visual representation of macronutrients, which include carbohydrates, fats, and proteins. Down at the bottom, it's telling you how many grams you have. And on the sides, it's telling you the micronutrients, the minerals and vitamins. And if you can see the tiny print, you'll notice that minerals and vitamins are measured in micrograms and milligrams, whereas carbohydrates, fats, and proteins are measured in grams. And that's where we get the terminology of macronutrients versus micronutrients. And also in your food is water and lots of other things. So among the nutrition learning goals and topics that you can start exploring is macronutrients and proteins. Their job is in general to be broken down. They're broken down into amino acids through digestion and absorbed, and then your body will reassemble them into structural molecules, including things like actin and myosin, and especially collagen. But then there's transport molecules and membrane proteins, hormones, enzymes, and an endless array of newly assembled proteins. Nutritionally relevant amino acids, you classify them as essential versus conditionally essential or dispensable. Proteins themselves are complete or incomplete, depending on whether they provide all of the essential amino acids for you. And then protein requirements vary depending on things like your age or your state of health. This is just a graphic. Really, it's kind of saying proteins that are inherently complete are animal-based. Proteins that are inherently incomplete as a single ingredient are plant-based. So for a primarily plant-based or a vegetarian or vegan diet, we know that you can use more than one incomplete protein to give you a complete protein, and that's where we're combining grains plus legumes and vegetables gives you a complete protein source. On its own, a grain is not a complete protein source. So learning goals include carbohydrates as macronutrients, and realize that carbohydrates serve as fuel. They're much less effective as a fuel than lipids are. So we use them for quick energy in small amounts, and we store whatever else we don't use as glycogen in muscles in a fairly small quantity, but the remainder pretty much goes to fat. And there is a concept of good and bad carbohydrates, and the general gist is the better carbohydrates are more steadily absorbed and appearing in your bloodstream, and the concepts of glycemic load and glycemic index are those learning topics to pursue. This is a very busy slide. you can find this article. It is full text available. I like this because it shows carbohydrates at the top and the various breakdown of the simpler and the more complex carbohydrates, mainly all the way on the right, are resistant starches that are not digested by our nutritious or our metabolic processes. They are actually fermented in the gut. And if you follow this chart when you have some time to look at it, that is one of the only endpoints in that diagram where it is energy intake control, with the exception of the slowly digested starches that we can get from things like vegetables that have more complex starches and fibers in them. Again, it promotes energy intake control. The endpoints of the other arms of that diagram are things like high blood pressure, overconsumption, insulin resistance, hepatic steatosis, glycogen stored in the liver. If you take a moment to look at this diagram, you'll notice that fructose, which would especially be relevant for high fructose corn syrup, is not just corn sugar. It is not metabolized in the same way that glucose is and leads to some problems that actually glucose does not. Lipids. So lipids are fats if they have a certain characteristic of room temperature, and oils if they're more liquid at room temperature. But they serve as stored energy that is accessible for you. Saturated fats are not inherently bad. It's the amount that matters. Saturated fats are fine as long as they are a very small portion of your calories per day. Monounsaturated fats are better than polyunsaturated fats, and the polyunsaturated fats include the omega-6s and the omega-3s, which I'm going to touch upon later. Trans fats are pretty much inherently bad, and I'll leave it to you guys to Google why. Micronutrients include vitamins and minerals, and again, they're usually measured in the order of micrograms to milligrams in the servings of food that we have. Vitamins are organic molecules. They are considered necessary for human life. Vitamins are species specific, so the same things that are considered a vitamin in a human is not necessarily a vitamin in other living animals. They are considered essential, such as B12. We can't make B12 on our own, or conditionally essential, such as D, where in certain circumstances we have to get it from an external source. But most vitamins we can actually assemble on our own as long as we have the building blocks. Fat-soluble vitamins include vitamins A, D, E, and K, and water-soluble are all the others. And there are also things that are vitamin-like nutrients that, for whatever reason, they didn't make the cutoff. We know they're very helpful, but we don't consider them essential to life. Minerals are all made in the earth. We do not make them. We have to acquire them. They are all essential. Bioavailability varies dramatically. So when somebody tells me they take a certain mineral supplement because they need it or because they want to, I am always reminding them that minerals themselves come out of the periodic table. They're either a positively or a negatively charged ion, and they're bound to something else. And depending on what they're bound to in the delivery system, they're not all created equal. So somebody that says, well, I tried that supplement and it didn't help me, doesn't realize they may not have been using an appropriately bioavailable source or eating foods that have it bioavailable. There is the concept of getting enough of something, which we're used to the recommended daily allowance, and too much of something, which is a defined therapeutic upper limit. There's some differences across the globe. In Europe, there's a little bit more stringent therapeutic upper limits. In America, we tend to think bigger is better, so we have a lot of dosing of over-the-counter supplements that they would never see in places like Canada or Europe. Complex interrelationships exist between these micronutrients. Example, the periodic table, the purple ones are essential, the green ones are suggested to be essential, and the rest of it is not necessary for us. Water. You've heard other speakers talk about this. I'm not going to really expand very much, but you really need to know the difference between hypotonic, isotonic, and hypertonic fluids. And the general sweeping rule, generalization that says everybody needs 8 8-ounce glasses of water a day is false. And I think you guys are starting to hear enough about this idea of isotonic or adequately salty drinks is sinking in. Just a graphic to show you the difference in hydration, or the amount of water that is expected in a healthy person at a given age. See the difference between a newborn that's about 80% water and the average adult man that's about 60% water. Seniors are a little bit less. It's just very, very easy for our children and our ultra young to become dehydrated. Hydration index, very quickly, the oral hydration solution is the biggest bar. Behind that, skimmed milk comes in a second in this particular study, and water, including still or sparkling water, is almost the lowest behind coffee. And I usually tell people not to make arbitrary rules based on hitting a certain number of ounces of fluid a day, but to watch their urine. And if your urine is pale yellow, you're doing pretty good. Other things in food, good, bad, and ugly. There are molecules that are hybrids of some of the macronutrients we talked about. There's nucleic acids that we can eat. They're not really too good or too bad, they're just there. But xenobiotics are the good and the bad and the ugly. There's some things that are great for you, there's some things that are terrible for you, including toxins, things that are either man-made or earth-made, such as arsenic, cadmium, mercury, and lead. So, dysbiosis, you've heard this talked about. Dr. Pace mentioned the microbiome. And normally, the bacteria in our gut help us not only with training our immune system, but they help us to metabolize things, to give us fatty acid energy supply, synthesis of vitamins, absorption of minerals, absorption of fat-soluble vitamins, metabolism of bile acids, sterols, and xenobiotics, fermentation of dietary residue, gut-related immune function, and neurotransmitter production. And if your microbiome is impaired, these things are impaired too. It's a graphic to look at to show you the steps from a fresh food to processed food. And I like to point out in this one, examples of fresh foods are things like fresh vegetables and fruits. Down in the corner includes ready to eat, ready to heat snacks, and things like baby food, which is kind of horrifying. Learn about what makes the Western diet different from an ideal healthy diet. In this graphic, we have the little pink box tells us that omega-6 fatty acids are inflammation promoting as compared to omega-3 fatty acids. So you can take all the fatty acid supplements you want that are omega-3s. If you're getting a lot of omega-6s from your diet, it's not going to cancel it out. We as physicians need to be better at recognizing the difference between eating disorders and physical gastrointestinal issues that occur for people with EDS. This one is talking about restricted diets. Vegetarians and vegans need to take into account that their diet alters their body's ability to absorb and process certain nutrients that become more critical as supplements for them. Learn to read labels. Also, you have to be challenged to find out what's in food that doesn't have labels. So this is, I wanted to emphasize, we don't have a lot of research. We have some literature. This particular article is written just a few years back, and it proposed a table, which you can't read, but it's a ton of supplements that are proposed on a speculative basis to likely be helpful in persons with EDS. And it was really emphasizing things like, is helpful because we have joint pain, is helpful because we have skin healing issues. And I did a tally on Amazon and put them all in my cart, and it was $441.58 per month. So I don't know about you, but I'm not happy just taking all of them because the literature speculates that they might be helpful. People ask me all the time about collagen supplements, and I would say I don't really advise people strongly for or against it because it's a protein. We need protein. But if we're thinking it's going to solve or cure aspects of EDS, realize that we digest that protein into its amino acids, glycine, proline, lysine. Collagen requires vitamin C to assemble. We're going to digest it. We're going to make it into smaller peptides, and our body's going to do with it what it wants. So there's no established research to really say that it helps. We have plenty of anecdotes of patients that say it seems to help them, so I don't really advise people against it. But you could have a diet that's just rich in the component amino acids. This is an article that may be particularly relevant to people who are struggling with joint and musculoskeletal issues, injuries, and recovery, to say that there is actually some data out there that says you can eat Jell-O and vitamin C, and having that on board is going to help you with some of your recovery, especially from athletic injuries. So to date, there's really no studies that tell us that diet and supplementation is doing something to cure the underlying processes at play in Ehlers-Danlos syndrome. There's no foods that you can eat to cure it. There's no things that you can avoid in your diet or to make sure you don't get in your supplements. And there's no backed foods or medical supplemental drinks, et cetera, that are specifically indicated for Ehlers-Danlos. This article, I just want to emphasize, I'm going to go fast here because I've technically run out of time, but I only have a few slides left. Malabsorption has been acknowledged for a very long time. The article I'm putting up there was published in 1973, recognizing that malabsorption occurs in EDS. Malabsorption is for several reasons, including the problem with dysautonomia, being stuck in fight or flight rather than rest and digest, inflammation happening within the gut related to both gut-related immune dysfunction as well as dysbiosis. This article has jumped from just the speculation about proposed nutritional supplements because of EDS itself, and it's combining EDS with dysautonomia. And again, it came up with a very large, busy table of a bunch of supplements and nutritional recommendations. And the points I want to make is that this is a very recent article, 2021, and it is talking about, the point to be made is that we're not really supplementing for the purpose of fixing the EDS. We're acknowledging that having EDS and some of the comorbidities is actually causing nutritional deficiencies. So if you want to feel better, you address those nutritional deficiencies. Modified diets and the use of supplements may improve symptoms attributed directly to EDS and dysautonomia, but the current research is just extrapolative, and there's no empiric studies to say that these supplements are fixing the EDS process. So it doesn't really matter why. I think for right now, we may find in the future research does support that some of these nutritional processes are helping our connective tissue directly. Nutritional plans need to be individualized. That is one key point that came out of this very recent article that was a review of available literature. And then we have another very recent article that is talking, it's really emphasizing, years ago, if you'd been at one of these conventions, we had to kind of fight to get doctors to understand that EDS comes with gastrointestinal comorbidity, and EDS comes with gut-related immune dysfunction. EDS comes with dysautonomia. This is an article that the patient size was 6,021 cases reviewed, where they came up with 2,007 EDS patients in a review of the hospital records and showed a huge amount of comorbidity, where the EDS patients had much higher than the normal population or the unaffected, non-connective tissue affected population for comorbidities. So I would argue we need to eat in order to address our comorbidities. And I'm gonna, in the interest of time and courtesy to the other speakers, I'm giving advice in this talk regarding some of the things that I've found over the years that have had good results for patients eating, following established physiology to say how you can minimize symptoms of autonomic dysfunction. Fluid rehydration with isotonic fluids, striving to have low glycemic load, low glycemic index, minimizing insulin resistance with what you're eating, making sure you're hitting nutrients that are known to be helpful in things like autonomic dysfunction, such as vitamin B12, magnesium. Eat to minimize gut-related immune dysfunction. And this is, I think, going to be touched on a lot by Dr. Maitland, but we have many immune dysfunction-related food choices that make us have to recognize what's going on. We don't often get a diagnosis given to us by a doctor of what foods we should and shouldn't eat, but you can kind of tell sometimes on your own what you need to avoid. There's ways to eat to foster your normal bacterial balance, including prebiotics, probiotics, and a diet, basically a plant-based diet. Doesn't mean you can't eat meat, it just means plants are very helpful. Some people need broad-spectrum antibiotics, some need probiotics. There's exclusions and limits, and they're all the bad things, like the sugar substitutes, artificial colors, flavors, preservatives, things like chemicals in cured meat. Alcohol's not the greatest, and many of us have to figure out, are we on medicines that are affecting our bacterial balance? Supplementation is commonly required, and I think one of the key points in this is that make sure you talk to your doctors. If you're taking supplements that they're not prescribing, it is like a drug, and they need to know if you're having drug-drug interactions with the prescription medicines that you take. You may need help from a clinician for specialized testing, and you may even need IV repletion when oral supplementation isn't working. Respect individualized needs. Exclusion diets may work for one person, not for another. Many people with EDS have found tremendous relief of symptomatology by avoiding wheat and gluten. And you need to review your diet with a clinician when you are being restrictive in your diet. A helpful clinician. It's a tangled web. Dysautonomia can aggravate immune dysfunction as well as GI dysfunction, and each in turn can aggravate one another. So it becomes vicious circles and snowballs and downhill. Each individual is unique. Each individual may have their own things that differ from other people with EDS, and this is where it becomes very challenging and requires a multidisciplinary approach. Thank you.